Hello, my name is Nicole Wilson and I am an EKU Family Nurse Practitioner student. As a nurse in a teaching hospital, I have seen several ways doctors round on their patients. More often than not, the clinical team parades into their patient's room as the medical team presents a patient using a jumble of jargon and medical terms no parent or patient could understand. This often leaves the nurse to pick up the pieces in a conversation they were not even present for. As medical complexity of patients increase, communication and collaboration between providers is key in providing the highest quality care. The critical role that communication plays in healthcare is evidenced by the Joint Commission's National Patient Safety Goals for 2014. According to the Joint Commission, an important goal for 2014 is to improve the effectiveness of communication among caregivers. There are several problems with communication and collaboration between physicians and nurses in that it often varies in structure and complexity, and the end result is often nurse dissatisfaction, frustration, and confusion in the plan of care. Through the use of interdisciplinary rounds, all members of the healthcare team are able to discuss the overall plan of care, safety concerns, daily goals, and discharge plans. Interdisciplinary rounds that include physicians, residents, advanced practice nurses, registered nurses, respiratory therapists, and pharmacists have become a useful communication strategy for all members of the healthcare team. The literature is consistent in that interdisciplinary rounds has been shown to improve healthcare providers' ratings of collaboration and teamwork, show higher ratings of provider satisfaction, improve understanding in the plan of care, and improve understanding in daily goals. Despite these findings, many institutions that use interdisciplinary rounds only do so in intensive care units. The purpose of this project was to provide education and evidence-based practice outcomes on interdisciplinary rounding to key stakeholders at Kentucky Children's Hospital, as well as form an interdisciplinary rounding specific committee. The idea and benefits associated with interdisciplinary rounds were first presented at Kentucky Children's Hospital Progressive Care Quality Safety Service Committee via a PowerPoint presentation. It was then moved forward and presented next at the KCH Staff Council meeting, where ideas and suggestions on improving unit practice are presented. Several key stakeholders were present at this meeting. The request for an interdisciplinary round specific committee was made at this meeting. The Interdisciplinary Rounds Committee then had their first meeting, which consisted of a nurse from each acute care unit, as well as a progressive care unit and 2 charge nurses. We discussed the literature, issues with current rounding process, feasibility, similar teaching hospitals, benefits, and how we could present the idea of interdisciplinary rounds and benefits to the doctors. The Interdisciplinary Round Committee then presented interdisciplinary round information via PowerPoint to KCH primary team doctors. The physicians were very receptive to the idea of interdisciplinary rounds, and the discussion addressed several issues with current rounds. In evaluating the project, the feedback was very positive from the physicians, and 2 joined the Interdisciplinary Rounding Committee. During the first meeting, the physicians and nurses gave suggestions and discussed ways to move forward. In moving forward, the physicians and nurses agreed there is a need to send out a needs assessment survey to nurses and physicians. It is also necessary to witness interdisciplinary rounds firsthand at a similar teaching hospital in order to change the structure and function of our current rounding process. Based on evaluating this project, I would have included the subspecialty teams from the start instead of trying to include them later. I would love to answer questions if anyone has them. Thank you for your time.